being here this afternoon to this wonderful celebration of a great program, Project Karinu. I want to thank all of the stakeholders who are here, the children. I want to first recognize my honorary vice chairman for the past few years. Right here is Jimmy. He's my honorary vice chairman. I want to recognize the presence of my colleague, Senator Frank Uggan Jr., Senator Tommy Morrison. Thank you very much for being here. And I want to, we'll get an opportunity to introduce everyone here, but I'd like to now turn the mic over to Terry, the Human Services Administrator for Public Health, and he can do the introduction. I know we have a special treat for us also prior to the start of our roundtable discussion. And really this is to give an update to the committee and to the people of Guam on the successes of Project Karinu. We're on the sixth year, right? 6th year. And so, this is a milestone for us, and we want to ensure that we continue the services that you provide. And so these types of updates are very important to be able to let the committee know, let the legislature know, and the people of Guam know the types of services that are available and the successes of your work. So Terry?
Yeah. Half a day and good afternoon. I'd like to, of course, thank the senators for being here today, and of course, especially our families and our stakeholders that are here in celebration of this event as well. Not enough can be said around early childhood mental health. So thank you for this opportunity, this honor to come to you. That way we can always keep early childhood mental health on the radar. So before we actually do our roundtable introductions, we are very honored to have with us the Chukis Church, who would like to do sort of an introductory song for us. And of course, this is on the tailgates of FestPac, so I think it's very appropriate. So at this time, I'd like to call Bertha Diamond Cachita and, of course, the Chukis Church Group.
We
Thank you. Thank you, Bertha, and thank you, the Chukis Church Group. Wonderful presentation. So as of now, we'll start the roundtable. Shall we start with the families? All right. Sure. Oh, I'm going to have them introduce themselves, yeah.
Say your name. You want to say your name? Okay, my name's Janelle, mother of Jay Edwards St. Nicholas. We've been in the program since he was 2 years old. And over the years, through Project Karinu, if it wasn't for them, he wouldn't get the help he needs. Now he's 5 and he's really shown a lot of progress. Thanks.
Say your name. No? Okay, he's a bit shy right now. But this is Jimmy, my little Jimmy. I'm Dr. Goffigan, foster mother for Jimmy, and I've had him since he was 3. And he will be 7 on Friday. So it'll be his 7th birthday, and he's very excited about that. But I attest that Project Karinu has really helped him a lot. He has blossomed into a beautiful young man, and I'm looking forward to sharing most of his life with us. And Jimmy, not only has Jimmy been a gift for our family, but he's really shared a lot of himself and a lot of great opportunities, and I see a lot of positive outlook for him in the future. And I really want to thank Project Karinu because they've really helped him a lot. And he's now going to be 7, but still Project Karinu is still a family for him.
Want to say your name? All the kids are shy today. Hello, everyone. My name is Jolene, and this is Caleb. And, I have many stories of how Project Karinu has helped my family and helped my son. The one I want to share is prior to Project Karinu, Caleb had really, really bad separation anxiety. Even if I were to leave him with somebody he knew, he would still cry and cry and cry. And he'd cry to the point where he would, throw up. And, as a mother, I've always felt guilty about that. So through Project Karinu and through the help that they've given us, on his very first day, very first time I sent him to daycare, he turned around with a big smile and he said, "Bye, Mommy, bye." And that's just one of many examples that I have with Project Karinu helping our family. And when your child has separation anxiety, there's really no other place to go to but Karinu to help out your child who is under 5 years old. So this is something that the community really, really needs. It's not, it's not just there for fun and games. It's really, really needed in the community.
If we have other families that are here that would like to stand and at least introduce themselves, our families, anybody would like to? Any of our families? They're welcome to do so.
Anyone want to introduce?
Hello, I'm Rita Tyrone from Talafofo, and this is Shantino, my son. He's 10 years old now. But when he was 4, I went to Project Karinu. I got their number through Naval Hospital, is how I got in touch with them. And they just sort of carried us through. On days when I didn't know what I was doing, I would call, and they would say, "Come on down, there's somebody will talk to you." And then whenever he became old enough, they passed him on to the next, what's the next one's called? Yeah, but that's a hard word. And he's still with them. And I just can't thank this, what do you call it, organization enough. Thank you.
Thank you.
Would anyone else like to share?
Okay. All right.
Hi, my name is Maureen Lujan. I'm the director for PNG at Leo Palace Learning Center, and I was a caregiver at PNG Tamuning, and we had Jimmy. He was my student, and we had graduation, right, Jimmy? And he was a strong man. Our theme for that graduation was Under the Big Top. He is such a pleasure to have. And I think I had, I didn't get your name, Caleb, because we worked with Project Karinu also as the caregiver institution. And we had a whole lot of fun. In fact, in the front of this pamphlet, there's one of our caregivers that's there, Ms. Ruby Palasan, working with, I'm not sure who that is. But anyway, that hula hoop that is there also belongs to PNG at Tamuning. So we did work really close with Project Karinu, and we haven't done it for a couple of years already, but I'm sure that if they do call us, we'll be willing to help out. Thank you.
Oh, goody, I get the microphone. So then we'll start with the table. Okay, so senators, of course.
Oh, Bertha wants to share?
Good afternoon, everyone. I'm the interpreter for Tsukis. If any Tsukis want to say anything, in Tsukis I can interpret for our Project Karinu. Please. Okay? There is two or three family. Okay, we have one.
Project Karinu Renee, 5 years old.
She's saying how thankful and how much she appreciates Project Karinu. Ever since her son was in school, he won't say nothing. But when Project Karinu service her family or her son was student of the month, and he even have award after award. Thank you, Project Karinu. Anybody else?
Okay, so then we're going to go ahead and start with the round table. Around the table. Yeah, I know. It's really short.
All right. Okay. So my name is Dr. Lily Perez. I'm an early childhood mental health clinician, and I work at Project Karinu.
So half a day and good afternoon. I'm Terry Uggan, and I'm the Acting Human Services Program Administrator for Project Karinu and Oversight with Guam Launch.
My name is Austin Uggan. I am Jay Edwards' stepdad.
So, Terry, before we continue, I want to recognize Senator Torres. Thank you for joining us, Senator. Thank you. And if we can, Terry, before we start the PowerPoint, Doc, and the others, they want to, I know we have Benny Servino, Director of DISID, who's here too. Just introduce themselves before Terry starts.
I'll start. My name is Kathy Schrader, and I'm the Head Start Director.
Half a day. I'm Ben Servino. I'm the Director for the Department of Integrated Services for Individuals with Disabilities. I'm also a member of the Systems of Care Council, and we collaborate very closely with Project Karinu and also the Ifamagunta program, as this looks at focusing our priorities now towards the youth, because in the past it's been mainly towards adults. We really need to look at it systemically from the continuum of care, from birth on to the elderly. So our real emphasis now is working proactively towards the needs of the youth and the children. Thank you for having me here.
I'm Dr. Lee Meadows. I'm currently a family practice doctor doing OB and pediatrics at Public Health, Daddy Doe. Many of you know me from the 20 years that I worked at SDA. And my credential is that I've done some 150,000 patient visits on this island, some 50,000 well baby checks. And I have a very strong need for Project Karinu.
It'd also be very nice to acknowledge our Chief Public Health Officer, Dr. Kenishiro. And actually, there are several stakeholders that are here too. So I'm going to actually step out of my seat real quick. Oh, we can use that wireless?
Hi, I'm Suzanne Kaneshiro. I'm the Chief Public Health Officer. I actually oversee the Division of Public Health under which Karinu launch and Bisita comes under.
Good afternoon. My name is Kathy Tydenko. I'm actually with the Guam Early Intervention System and with the Special Education Preschool. I just wanted to add that, we work closely with Project Karinu because there are some children that don't end up receiving services from us, but that link is so important because there are other children that might, if not the services from Project Karinu, might need special education.
Good afternoon. My name is Diana Calvo, and I'm Executive Director with Catholic Social Service. We are a provider that currently in our work with young children is through our protective shelters for ALI, as well as our protective shelter for ALI women and their children, as well as our homeless shelter. And in the work that we do, the kids that we receive, we're either mostly a referring party, or we're part of the network of providers that is involved in that particular child. And in our work, and even in my work when I was at Public Health, early intervention and early assessment and diagnosis is what Public Health uses to ensure that we capture those situations so that we can have a more positive outcome. And bringing mental health services, to toddlers and the young kids is really, I think, one of the best ways for all of us, including the senators who are always campaigning about investing in our children as the future of Guam, to ensure that there's support for the early childhood system. Thank you.
Hafade, my name is Marissa Uggan from the Healing Hearts Crisis Center as part of the Guam Behavioral Health and Wellness Center. And the work that we partner with Project Karinu is really invaluable. As the Rape Crisis Center, we deal with all ages of victims, starting from the very young, starting from 1 and 3 years and 3-year-olds. And the services that Project Karinu provides and the help and assistance we're able to get with them to help us work with our youngest of the vulnerable population, it's incredibly invaluable. And we look forward to continuing the work, and as they continue to grow as well, and adding the services beyond age 5 up to age 8, it just gives us more and more of an opportunity. Thank you.
Good afternoon, and Hafade. I'm Dr. Heidi Siniclas, the University of Guam Cedars, and we had the privilege of being involved with Karinu and Ifa Maglanta from the very beginning. And I think I wanted to share one thing that maybe a lot of you don't know about Project Karinu, and maybe part of why it's so successful. And a lot of you are looking at me like, what is she going to say? When we were finishing up Project Ifa Maglanta and thinking about next steps, the whole early intervention, early childhood, infant mental health was a definite place for us to begin, because we were already as a community doing a lot of things in the area of early childhood. as we worked in bringing the community stakeholders together to get the grant application put together, we actually lost somebody very dear to us on Guam, and that was Karina Oshiro. And she used to work at Guam Early Intervention, and then she worked at Guam Cedars. And Project Karinu actually was named after Karina. And I like to think that her spirit of being a mental health provider as well as an early intervention specialist, and she worked with many of the families here who had young children who had some pretty critical needs and demands, and really being able to provide seamless services. So I'd like to just share with you that part of the blessing of this project, I think, has started from somebody above who's looking down and is definitely helping our community along. So kudos to everyone, and I really hope that the community will be able to continue this effort and maintain it, so that all of the hard work that all of the stakeholders, and I don't think I've ever seen so many families and children together at the legislature. It really is a testament to the leadership of public health, to Dr. Cisan, to Terry Uggan, to Lily, and to the whole team. So thank you very much, and congratulations to everyone.
Thank you. Thank you so much. Anybody else would like to speak up from this side? We're going to complete the table. And thank you for mentioning about the homeless, and the homeless, especially around young children, is a very vulnerable population. So one that we definitely want to tap into.
Hi, my name is Charlene Cruz. I'm with Guam Behavioral Health and under the iCare Guam expansion grant, and we are building one systems of care with Project Karinu.
Hi, I'm Nia Cerneo, and I'm the social marketer for Guam Behavioral Health and Wellness Center's iCare Guam grant as well. And our mission is to expand and implement system of care on island and really create that infrastructure. And definitely we would not be able to do that without the wonderful efforts of Project Karinu.
Thank you. Linda?
Hello, my name is Linda Rodriguez, and I'm the administrator for the Bureau of Social Services Administration. I want to take this opportunity to thank Terry and Dr. Lily, who has always been there, especially for our children who have been abused and neglected, and they're always readily available there to help us when they have behavioral issues and provide services. And the whole team from Karinu, we thank you from the bottom of our heart. And to my right is my supervisor, Arlene, and she will introduce herself.
Good afternoon, everyone. My name is Arlene Gadia, and I oversee the intake crisis unit within the Child Protective Services section of our bureau. So, as Linda has said, it has been very, very helpful to have Karinu, partner with us, especially with them just being downstairs, and especially when, like she said, when we have children and we respond to crisis situations, and we find children at a very vulnerable state sometimes. It's so good to be able to have them readily available. But I can also say that outside of the Child Protective Services, we have many children out there that they get reported to us, and these referrals don't necessarily meet the eligibility criteria for abuse and neglect, but we do find that there are certain risk factors within the families, and so amongst the other partners we've worked with before, early intervention, DOE programs, Ifamagunta, to have Karinu available for the much younger set of children, and to be able to make those referrals to them, I'm sure that it also contributes to the hopefully the decrease of referrals that we do get, because we can get intervention early on. So thank you very much.
My name's Richard Brown. I'm a parent. The way I got that way was because I had a business partner who had a son whose father had died when he was 2. The boy, preteen, decided that he didn't like being around me and he was going to adopt me. So I didn't have a lot of choice in the thing. But he had been sent away between the ages of 2 and 7, probably suffered a good bit from separation anxiety disorder, and he had some issues. These showed up in his early teens, and with the help of Ifa Magonta there at that time, he made great strides. And he's 23 now, working in California and doing great. So I guess I'm one of these parents that can say, I've seen the light at the end of the tunnel. I would like, and because of this, I've continued to work in system of care, on work groups and various areas, especially involved with evaluations. And one of the things I've learned in this is that Guam actually is doing pretty well compared to a lot of places on the U.S. mainland. And I think it's something that we ought to be really proud of. We need to keep it going. It's very, very important that we do this. The Guam Legislature has been really good in past years about looking out for people that needed help. All of you senators there, I know, have worked on projects like this, and those before you. My father-in-law, the former Speaker, Larry Ramirez, worked hard for all the senior citizens. There had a lot to do with getting GARP SPEMA started. So they were looking for support. It's that time when we got to step up to the plate here locally and fund this, but it's really important that we continue on with it because I've seen it work. We see success stories all the time, and it's worth keeping going. Thanks. Jusmasi.
Thank you. Hafode. My name is Al Silveri from the Guam Office of Minority Health at Public Health. And from day one, our program has been working with Project Karinu on so many levels because they represent also the diversity of the island. And we provide culturally and linguistically appropriate services, which every Project Karinu staff member has completed to high success. And we continue to look forward to that to help bridge the disparities that exist today. So thank you, everyone.
Half a day. I'm Bonnie Brand. I work with Guam Cedars, and I'm the evaluator on Project Karinu. I was also the evaluator on Ifa Magunta. And I just wanted to introduce myself in case the senators after the roundtable would like more information about the data. We specifically wanted to keep today's focus on families and services, but we do have extensive evaluation data, and I'm happy to provide briefings for you on that.
And I know time is of the essence, so we want to make sure.
Half a day. My name is Michaela Nicholas, and I was a UOG student under the social work program. I graduated this past May, and I've had the honor and privilege to work with Project Karinu, Guam Launch, Project Bisita, and of course all these families here. I've seen the difference the organization has made in the community, and I hope you continue to help the organization. Thank you.
Should we continue with the senators? Okay. Okay, so presented to the 33rd Guam Legislature, and I kind of wish there were more here, but you know, the ones that are here for a reason, and so thank you very much. Next. Hopefully this presentation will answer a few questions, who we are, who we serve, what we do, who we partner with, as well as our family voice, and things that are to come. So just a little bit of background information. I know that Ms. Heidi Nicholas shared with us the title or the name and how that came about. And that wonderful history, actually, I didn't know. But what I did know was that the Department of Public Health was funded in 2009 by Substance Abuse and Mental Health Services Administration. And this at the time was an $8.3 million grant for a period of 6 years. And its purpose was to develop, implement, and sustain, it's a big word, an early childhood system of care. So even at the time, the federal government recognized the importance of having early childhood services available throughout the community, not just nationally, but globally as well. Thus, Karinu was created, early childhood mental health program that addresses the social, emotional, and behavioral development of young children birth through 6 years of age. Okay? Originally, the grant was birth through 5, but we found that some of our children that were coming in were at the tail end, and it didn't make sense to refer them when we could complete our services. Nobody does it by themselves. Nobody in this room, whether you're UOG or Catholic Social Services or CPS or whatever the case may be, does it by themselves. And of course, Karinu has been partnering with Protective Services, with our primary care clinics, such as Dr. Meadows and the previous physicians. People come into Karinu through an avenue of gate holes. And so one definitely is having Karinu in a public health setting gives us access to programs such as Guam Launch, Basita, our dental services, our special kids clinic, women, infant, and children programs that provide nutritional items for children actually and mothers. The MIP Medicaid component, which supports the insurance, well baby checkups and immunization, all these things that help develop a child physically, coupled with Karinu that supports the mental aspect, is a whole health approach. And so that's our goal. So why is Karinu embedded into the Department of Public Health? For very obvious reasons. Our partners are more vast than what's listed here, but just to the recognition of the public health ones that were previously mentioned on the last slide. Of course, Guam Department of Education with our GEES, Guam Early Intervention System, our Head Start, our special ed, and our elementary schools. And we're doing a lot more with our elementary schools. Guam Behavioral Health and Wellness Center, IFA Magunta, and iCare Guam, the Peace Office. And these are key because as we start to build more of the one system of care approach, with Karinu addressing the early childhood and Famagunta addressing young adult, we have a continuum of services out there in our community. And the services between the two programs are vast. The services for a young child are quite different than that of an older child. Okay, our child care centers, and we mentioned P&G, but primarily because the staff are trained in taking care of and providing services to children that have social emotional concerns. But there are multiple other child care facilities that out there that we partner with. Guam Cedars, the School of Nursing, working with the social work program. Of course, not just our government side, but our community-based organization side. Parents Empowering Parents, Catholic Social Services, Gifts, Guam Moms Helping Moms, Salvation Army are just a taste of what's out there and who we need to partner with. Of course, CBO, government, we always should have a strong faith-based component. And through the years, we've partnered well with Santa Barbara, Father Paul, San Vicente, of course, the Chuquis Mass team that sang today, the team over at St. Jude's and the Cathedral Basilica. But there are many, many more, and I don't want to insult anybody or leave anybody out. But so at this time, what I'd like to do is go ahead and turn the microphone over to Dr. Lily Paris. I'm kind of sliding through these screens a little quickly, so if you want any of us to slow down, we're more than happy to. That way we're very clear about our point. But I'd like to go ahead and introduce Dr. Lily Paris.
Thank you, Terry. So I took some time out this morning to work on my t-shirt. And in case you didn't read it, it says almost 800 served. So we've been working with almost 800 families since we opened our doors. So I just wanted to make a note of that because I think that's pretty awesome. And so how old are the children that we work with? About 19% are below the age of 1, and about 11% 2-year-old, about 21% 3-year-old, almost a quarter are 4 years old, almost another quarter are 5, and again we have that 1% over 5 who are 6 years old. So you can see most of the kids that we work with are concentrated in the ages 3, 4, and 5. The average age of the kids that we work with at intake, they come into our programs, they're usually about 3 years and 2 months. And for every 10 referrals we get, 6 of them are boys, 4 of them are girls. And so who are we working with? A good chunk of them, almost 3/4, are Chamorro mix. And then we have about 10% who are Filipino mix, 7% who are Chuukese, another 5% who are other Micronesian, 1% who are Asian, not Filipino, and about 2% who make up the other population. Okay. Of the almost 800 children served since we opened our doors for service delivery in 2011, so the breakdown is such: the bottom of the pyramid gets the most, and they're 55%. So this is the universal screening and universal services that are offered to children, about 440 children. And so what's happened is, when we started, Project Karinu did that kind of on its own. And since Guam Launch has been funded, we now partner together to address that particular component. About a third of the kids we've worked with, their needs are a little bit more sensitive, and they require support plans for the family, about 30% or 240. When we started, the whole emphasis was on wraparound, which is about 10% of the population. And so these are the kids that we get from like child welfare, from the alley shelter, also from Healing Hearts. These are kids who might even be homeless. There are multiple agencies involved with them, and they've been in the system for a while. And so their plans, their service plans, require a little bit more work. And what we found since we opened our doors is that there were, as some of the parents have said, there were some really young children who needed more than just service plans. They needed clinical services, and we didn't have anyone to provide that in town. And so what we did was we said, let's check it out. And so over the years, we found that about 5% of our kids require clinical services, which is a new element to our pyramid. And we're actually looking at the very top two components, the wraparound services and the clinical component, as a way of sustaining our services through the years. Okay. So what does it look like? What are we helping our kids with? About 30% come in for relationship issues. Parent-child relationships, sometimes sibling relationship issues. 40% come in for physical abuse, sexual abuse, or major neglect, as Linda Rodriguez was sharing with you. We have about 36 who come in for adjustment issues. These are kids who might have been removed from the household, who may have lost a sibling, whose parents maybe are incarcerated. So something big happened in their life, and they are having difficulty dealing with that change. What we also found, and like the last three bars there are the same color, they're green because they're all kind of connected to education. When we started, our biggest referral source was child welfare. That's the 40%. But over the years, what we found is that we were partnering more with Guam Department of Education, with the young children, and that's the last three emojis that are up there. So we're looking at about 34% who were coming in for pervasive developmental issues, and or otherwise known as autism spectrum disorder. We're looking at about 23% who come in for attention deficit hyperactivity disorder, and about 20% who come in for learning, motor, or other communication kinds of issues. And it equals more than 100% because some kids have more than one presenting problem. Okay, yeah. You were like, I don't think she knows how to add. It's more than 100. Yeah, yeah. And so you know what I like to share with folks is when we work with little ones, we cast a big net with a small mesh, because we want to be able to capture as many of the potential problems as possible, because if we intervene early, the likelihood, the trajectory thereafter is good. If we use a wide mesh and a small net, we're going to lose them. Okay? Okay. And so what difference has it made? From intake, about a year later, and this is where CEDARS and the evaluation comes into play, 49% of the kids who are acting out have improved. And that's about 30% of all the referrals that come in initially. The presenting problem is they're acting out. So sometimes not even sure which verbiage to use. So almost half, have improved over the year. And if you're curious about that, as Bonnie was sharing with you, we do have on the table here various handouts on evaluation from 2014 all the way forward. And the evaluation doesn't just capture like the services that we did with the children, but it also captures services provided to families, which is a really big piece. Okay. And then the last piece I wanted to share with you has to do with this dollar. And I asked for $1. I asked someone for $1, and I got $1. And the reason why I asked them for $1 is, if you invest $1 in young children now, your rate of return is 7 to 10% every year. Meaning to say, if you don't give us this dollar this year, you're going to spend $10 next year. So if you put $1 in this year, you're going to save money. All right. And so this, of course, I would support this, but Dr. Heckman, he's a Nobel Prize laureate. He's a professor in Chicago University, and he says he did the math and he figured it out. So I just want to say, thank you. All right.
And while we're bringing the mic over, I just want thank you, Dr. Liddy, for that presentation.
You're welcome.
We have other senators that are also who are not here with us, or not able to, but are watching. And we'll also this is being recorded, so this DVD would be provided to all the senators, so that at their time they can be able to review it, especially as we head into the budget discussions for 2017.
I appreciate that.
Okay, thank you. And Senator Tom Ada, he wanted to make sure, because we were texting each other, and he says he's watching and he's very interested in this as well. So thank you.
Half a day. I'm Pauline Camacho. I'm the lead family partner with Project Karinu, and I would like to acknowledge our family partners. Miss Loli, stand up. She is standing. Wave your hand. From Project Karinu, Miss Lolita Leon Guerrero. Also, Miss Bertha Diamond Cachita back there, who sang for us. And also from Guam Launch, Tammy Bamba, who is back in the corner. Oh, there she is outside. Our hardworking staff, so I want to acknowledge them. But Project Karinu, the word Karinu means love or bonding. And we're all about loving our children and watching them grow to be healthy, successful adults. But our partnership with families, that is really, really important. We're child-centered, first of all. We're all about the children. How do I click? Okay. We're all about the children and helping them. And a lot of people say, how can a child, even a newborn, have social, emotional, behavioral, or mental health issues or needs? And, babies, don't look at their parents, turn away, won't feed, failure to thrive. There are different issues. I think deep down, a parent knows that they need help with their child, and so we would be the place to go to. Anyone can make a referral, a parent, a doctor, a pediatrician, parents themselves, child care centers. They make a referral, and then it goes through Guam Launch, this big banner back here. They'll be based up in Northern Public Health, and they'll be screening children, and any issues will come together to the table and make that referral to Project Karinu. Once we receive the referral and the child is deemed eligible, then we put them through something called New Family Orientation. We've had 301 families come to our New Family Orientation. We teach them about system of care values, the fact that we're child-centered, we're family-driven, we're all about the families. Every family drives their child's success. They have input on everything we do for their children and what we do to help them with their service plan. So we're all about the families. At the New Family Orientation, we do the screening and intake. They do all the assessments. Dr. Liddy does further testing. A lot of parents, if they want SPED services, don't know where to go. Project Karinu is the place to go, and all the services were free. We stress how parent involvement is so important. Parents who are involved, their children succeed, and you see a lot of them sitting out there. And so, by the way, let's give them a hand, our families that were here today. Yay. this is the first time they meet other families, and peer support is super important. You're going to find out. Click. I'm sorry, we don't have. We're a home visitation program, so we go to the homes. Because a family can't come to us, they don't have transportation, that is not a barrier. We'll go to their home. And so, the term is servicing a family or helping a family in least restrictive environment. Basically, their natural setting. We can observe the children, help them out at their home. We also have other supports, peer family support groups. We've had 390 caregivers and parents come to these. And all the studies show that peer-to-peer support is the best way. When a parent says, oh, I did this with my child, other parents listen. And so they're like, oh, I think I'll try that at home. But very important are peer support. They make those social connections. They build friendships. And I think a lot of our families that are sitting here can attest to that and have participated in these. Okay, the next one is at our peer supports, we have different trainings. A lot of them, through our trainings, have improved their parenting skills as well as their personal skills. And we try and cover all the different topics that they say they want it to cover. We're talking about parent empowerment. It's all about capacity building when you have training and teaching. Even our grandmas who watch the kids, they've been parents a long time, but you can always learn something new. And these trainings are exactly for that reason. We have evidence-informed parent cafes. We've had 184 attendees, and we conduct these. It comes in threes, if you can attend three, but through the parent cafes, they build trusting relationships. They share parenting skills. You always have, it's a peer support type of event. They have to use I statements, and when you say, oh, I did this with my child, I tried this, and when others hear, they're like, oh, I think I'll go home and try that with mine. So never giving advice, but just sharing what they do with their own children and learning from the experience of others. We have parent respite playdates. When you have a child with behavior problems, a parent needs help, you need respite. And so we would conduct these play sessions, in which P&G, and I heard her say, we haven't called them in 2 years. No, it hasn't been 2 years, maybe a little over a year, because our funding actually ended, and it was just, warm bodies in there. But we have continued to service families and provide respite. P&G is our emergency crisis. If a family is having problems and they need to get their kids in a safe space, they would call us, and we would call P&G to take their children, and that's always been available. And when parents drop their kids, they don't have to worry. They go to church. It's time for them to do some self-care, self-reflection, and just relax and have that free time while the kids are in a safe space and having fun learning experiences. So we provided all this. We've also provided Playport Playdates. A lot of parents some children have never even gone to Playport, so it was always a fun thing. Here, parents had to stay with their children, and there we RAP coordinators would observe interaction with their children, how they play with them. It's a great bonding experience, and the kids make new friends all the time. So that was always a really fun event that we would do for them. Every time we have an event, we have a arts and crafts make and take, and parents took the lead. Every time we have a support group, we ask, okay, who wants to share something at the next support group? And they take the lead, whether it's teaching how to make a marmar or how to make a little photo album, whatever. And so they would learn new skills, and then just have a lot of pride in making something and then taking it home for their children. And so that was always a lot of fun. And like I said when we started, that Karinu means love, and Terry was supposed to change that photo. but all these little T-shirts hanging around. The families themselves made them with their children, and it's the family voice, which is the most important. So I hope you will take time to read all the messages. But our message or takeaway, what we'd like to say is, Guam's children and families love and need Project Karinu. Please don't let it go, or don't let it go away, more so. So we're looking to that, and I know at this point we want to hear from the families themselves. They're the most important persons really at the table and attending. I think the kids are doing so awesome. We have food out there if they need it. And so all of you, give yourselves a hand back there. You're doing fantastic.
Terry.
They took away my cordless, so I'm going to be introducing Dr. Lee Meadows in just a moment. But Pauline, thank you very much for that information. And I think when people hear the word play and Playport, they kind of think it's fun activities and hoorah. But there's so much more that takes place when you're looking at young children. And the fact that 75 to 85% of their brain is developed by the age of 3. So during play, children learn to trust. They learn to explore. They learn to share and bond. And so these are some of the basic skills and emotions that children need to have to grow up and to be able to be healthy adults. And we talk about, children playing and being able to problem solve. Again, these are key as they grow up and they're faced with social emotional issues. And we know that on Guam we have very high incidence of suicide, of high school dropout, of many other things. And we want, we really want to strive to have Guam as healthy a community and to shine the way it did, especially during FestPac. It shined on multiple levels, not just the cultural part, but it took with it so much. So I put that out there because when we talk about different activities for family and peer supports, we're really talking about the underlying message that families really do build from and take from, and they implement those skills into their home, and that has a domino effect. Even as adults, when we look back or we're faced with challenges, so often we look back to how we were raised, how we were nurtured, what worked then, and how we bring that into our own homes when we raise our children. Now, we are a generation who's, well, for me, parents who went through World War II. So cuddling and nurturing and learning to play and trust was not the priority. It was dodging bullets and putting food on the table. So it's not like we've had a generation after generation of being able to say really what children need for social emotional to address them. And so I put that out there because too often we say children do not come with directions. Well, Karinu provides the direction, it provides the opportunity, it provides the voice, it gives that opportunity for parents to share and to build. So, Dr. Meadows?
Thank you, Terry. I'd like to bring a little bit different perspective. Terry, you've done a beautiful job of presenting what this project does. But I'd like to direct some comments more toward the senators as to what my perspective as a healthcare provider on this island is. First, most of you know my background, but I grew up in a Seventh-day Adventist. I practiced for 20 years at the Adventist Clinic. The Adventist Clinic is known for holistic medicine, for its wellness center, and for prevention. What most people don't know is that I build more prevention medicine services than the entire rest of the clinic combined every year. My last year working at the clinic, I billed over $500,000 of preventive medicine services. This has been my passion. I do well babies, well children, pregnant ladies. This is my passion, to keep them well, to identify threats to their health so that they remain well. Now you think of our wellness center at SDA as we put the treatment of diabetes on the map here about 10 years ago through our wellness center, and dealt a lot with lifestyle diseases. What most people don't realize is that there are lifestyle diseases of kids too. And the major lifestyle disease of children is mental. If you look at people that have major mental health problems, they start in their 15, 20, 25-year range. If you're going to deal with diabetes and heart disease, you got till age 40 or age 50 to get people into good habits. But by the time you reach 20, you're in trouble. You're in big trouble when it comes to mental health. And if you're going to prevent mental health problems, you have to start not only before high school, before middle school. You even have to start before grade school. Now, I want to switch a little bit from my expert testimony to my personal testimony, and then I'm going to come back. I grew up in a family, by the time I was 8, in a very stable family, very God-loving family, happily married. We got a new Cadillac every 3 years. We lived in a brand new 5-bedroom house in a nice neighborhood in Washington, D.C., and I went to private schools. I had very successful parents. My parents taught me how to walk and talk and drink and eat. I don't know how meat tastes like. I've never tasted alcohol in my life. I don't smoke. I walk 75 minutes 7 days a week. I try to keep my weight down. I'm not going to die of a heart attack. I'm going to die of mental disease long before that. I left this island. I was medevaced from this island in April 11, 2011, when I had a major mental breakdown. And after they had to take me, I was medevaced within 2 days. I spent 2 months on a hospital ward. It was 18 months before I went back to work. I suffered a bad depression, a bad brain attack. And just like with a heart attack, you may get your function back, but your heart isn't what it used to be. I don't have nearly the mental energy I did before. Those of you that knew me when I was SDA, you hardly even hear from me now compared to what I used to be. I suffered. I really suffered. And my disease was 100% preventable. Let me tell you the other half of the story. I was a stable family by the age of 8. My dad was an alcoholic. He changed his major in college to become a cadet, and he spent his service all through World War II in the Asia Theater. He came home with no career, no job, with a bad drinking habit, a chain smoker, married my mom, and by the time he died, 3 weeks after my 6th birthday, from the results of getting drunk at a Labor Day picnic and all of his smoking, everything else, he died of heart failure. My mother is one generation removed from Old World Austria, Bohemia. My mom was a rocket scientist. My mother graduated from high school at 16, college at 20. By 25, she was a published NASA scientist. She helped discover the ozone layer. She was the only woman that had an experiment on a satellite. My mother was literally a rocket scientist. She was the breadwinner in our family. My dad didn't get his college degree till I was 1 year old. He worked as a stocker in a Safeway store as I grew up. And Mom did not know how to share love. Mom never hugged me. They don't do that in Austria. I grew up with my dad spanking my mother, beating on her, screaming at her. I can remember the day Dad came home with our brand new car that he had rolled in a ditch, being drunk. The seeds to my mental health were all planted before I was 6. By the time I was 14, I had my first major depression at the age of 14. By the time I graduated from my medical training, I'd had 3 major depressions. I'd had 3 years of counseling. I was almost kicked out of my residency because of mental issues. Fortunately, my residency put me in weekly counseling for the rest of the 2 years I was in that program. Back to Project Karinu. I talked to 2 providers before I came here today. One was Dr. Hope Cristobal Lujan, who's a psychologist on this island. She deals with a lot of parents. And I asked Hope, I said, you talk to a lot of young women. What are their concerns about their kids? And she said, they're concerned about the kid that doesn't behave right, the kid that has a problem with being hyper or being difficult to get along with, or all the things you saw up there. She says, my parents have no idea where to get help. Who will evaluate these kids? And as much as I love DOE does not have the personnel that are trained or know how or have the proper credentials to identify mental health problems, including ADD, including autism, including learning disorders, including depression. They don't have. The report when I was on the school board said that DOE should have 25 trained psychologists. That's about it. Nobody with a master's or a doctor's level. You can't diagnose a learning disorder without a doctor's level. I have a daughter going into that, I know. Anyway, I talked to another very prominent pediatrician on this island this morning, who works with us, also works with a private practice. I said, what are your parents' concerns? She said, they don't have any. They're just worried about getting food and clothes. Yeah. I had a hard time not trying to educate him. And that is where we are at medically. Most of our medical doctors do not have the burden I have had for preventive medicine for 30 years, and they don't see it. They just don't see it. I'm proud of your 800 families. I see 5,000 families a year, every year. And the need out there is so huge that this is where I wanted to get to you senators. The program is great. It needs to be 10 times bigger. It needs money. Now, I have one more daughter. My oldest daughter is a marriage and family counselor. For 10 years, she worked for the state of Nevada. She was upstairs, or in the same building, I should say, as Child Protective, and her job was to take families who were at risk and give them in their home with a structured program 2 hours, 3 hours a week of parenting, not with dysfunctional families, but with families who were at risk for the things you mentioned, for incarceration, for having seen abuse in the family, for young parents, for loss of a parent. And the state of Nevada they have four counselors in Churchill County, which is the same population as Guam, specifically for their prevention program aimed at young children and young families to prevent the problems. And one thing I skipped, and let me go back to it. What are the threats to our population? What are the things that cause morbidity, sickness, mortality, death? Number one cause of morbidity and mortality from age 1 to age 30 is injury. And that divides into unintentional injury, accidents, and intentional injury. And I will beg of you that in our teenage and young adult population, intentional injury is the number one cause of death on this island. We only have 1 or 2 kids who die of auto accidents a year, 1 every other year who drowns. How many do we have that commit suicide? We've lost a few kids from child abuse. We've had a lot more get hurt. We've had a lot more mental damage, mental injury to our kids than we want to recognize. It's the number one problem, health problem, in my opinion, of children is mental health. It is not physical health. And I'm sorry, I'm getting passionate. And it's a problem that Project Karinu is addressing, but they're such a small drop in the bucket for the problem we have. And I just wish that, how do I say this nicely? The place where the problem is the greatest is in our Micronesian and immigrant population and our poor population. They're a population that doesn't vote. They don't have any voice. They don't know how to come in and talk. They're very quiet, very respectful, and they won't present their needs. And this is the population I work with now, every day, every day, every day. And we have a Medicaid population of 40,000 people. We have 2 doctors, 3 doctors to see it. We have no funds to pay a doctor so we can get doctors. And our population isn't going to scream to the legislature like a Guam employee does and says, you can't do this to us.
If I may, Dr. Meadows.
No, I'm going to quit. Yeah. Thank you.
Well, I just wanted to also acknowledge, in working with the families and children, that with our Micronesian population, while we do have many needs, we also have witnessed truly, the depth of strength and resiliency.
Oh, for sure.
And so I wanted to be able to share that, because I believe that we've learned also from working with them, and really to acknowledge they are our brothers and sisters. I do want to say that with regard to Project Karinu and the families that we work with, what we've seen also, kind of a new emerging trend, is the need for housing. Actually, children are the new face of poverty, and it's becoming more evident, I guess, in the work that we've done. But we do want to acknowledge that, and in many of the things that we do, we try to be culturally and linguistically competent as well as sensitive. We have produced material that is bilingual, English Chamorro, English Chuukese, English Palauan, English Tagalog, etc., with regard to early childhood development, particularly notions of play and the benefits of play and the parent-child relationship. So I just wanted to be able to bring that back, and I wanted to say thank you for sharing, your own trauma, because that is very therapeutic, to be able to share that. I also wanted to acknowledge those family members that weren't here, that we invited, and who say to us, we would love to be there, we love your program, but it's not us to be able to go there, or sometimes having difficulty with transportation. But the resilience that we've seen in the families that we've worked with, I wanted to highlight, is a key piece. Of course, the funding is important. As I said, for every dollar you spend now, you save 7 to 10 next year. To be able to say that, because our intention here was really to show you, in the 6 years that we've had service delivery, we wanted to show you the impact that we've made. How many families we've reached, and how we're continuing to grow this. We work within the Department of Public Health to look at other avenues for funding. I wanted to share that. I think Kathy also had some information she wanted to share.
And as I pass this over to Kathy, it's so true that there's still plenty of work to be done, and we are rolling up our sleeves every day, and we're diving in. And Dr. Meadows was very clear about the fact that there are so many people on our island that clearly are in need. But even the drop in the bucket, that makes a gallon, starts with a drop in the bucket. So we're on the right track.
Good afternoon. I'd like to share a perspective of one of the collaborating agencies that works with Karinu. Head Start's been around for going on 51 years. In 1972, the first set of standards for the program came out, very strong with a mental health component. So since 72, all the way through, almost through the time that Karinu started, Head Start has struggled on island to meet our standards of mental health services to families, education of families, providing some, we provide the structure and we work within the program, but the consulting part, the collaboration, we didn't have any child psychiatrists on island or psychologists on island. So we really, we did our best. But when Project Karinu came in, we share a lot. In the last 5 years, 5% of the Head Start children and families have been referred to Karinu. in return, Karinu sends me about almost as many. So we work together because both of our families in Head Start are the low income, the extremely high risk. When it comes to mental health issues, we've got separation, we have maternal depression, and poverty has just in its own realm many risk factors for our families. So we've been working very closely with Project Karinu. We share all the parent cafes that you saw. I think out of at least 8 have been shared with Head Start staff. We've been cross-trained with Karinu. It's a very valuable partner for the low-income families, and particularly for Head Start. I'll be very happy to say I really don't want them to go away. But they've been a strength. They provide the services. We share well. A lot of great things have happened since Karinu came on board with the systems of care. We've always been working toward it on Guam. Systems of care has been around for a long time. But again, early childhood is the forgotten. Babies don't have any mental illness, only the families. But with Karinu and the partnerships that have developed with even other agencies, not just DOE, with the early childhood community, for every $1 that you put in early childhood, be it for mental health, Head Start, or any other early childhood agency or services, you're going to get the 7 to 10% back on it. But we really need to keep the agency going for the collaboration piece, because we've made lots of strides I would say in the last 6 years, especially with providing the necessary services and setting the groundwork. Because when we do the parent education piece and the parent training, the more people that we can get to do it, it shouldn't just be Project Karinu. It shouldn't be just Head Start. It shouldn't just be our community organizations that we work with. It needs to be all of us, the whole community. Because without the community support and spreading out the wealth, where we all have a stakehold and we all participate and we help each other. And that's been one of the best pieces with Project Karinu, at least for Head Start. We share resources, we help each other. I don't have to worry about finding a mental health consultant anymore, because we have those 3 to 5 year olds in Head Start, and it's nice to have a place to send them, and they come and see us too. So it's a really good relationship, and I just wanted to emphasize that as a collaborator, a positive collaborator.
Thank you, Kathy. At this point, I know we have maybe 5 or 10 minutes left. We'd like to hear from the families. Basically, if you can tell us what your child was like before Karinu and then after, what your child is like now. So any of the families like to share, especially the ones at the table? Oh.
They shared theirs.
Before and after. Really?
Sure. We have a mic. Any of our family?
Well, I know everybody pretty much knows about Jimmy here, but when we got Jimmy, he was just about going 3 years old. He didn't walk at all. He didn't speak. He just really was just a very withdrawn child. So he was, I'm sorry, but when I say these things, it's because I've seen a lot of strides, positive strides with him. I have a son of my own. I have a granddaughter. And so when we decided to take Jimmy, as a foster child, I had very mixed emotions about it because I didn't want to get attached to him because I never know when they're going to take him away from me. But I'm glad to be in his life, and I'm very glad that he's in mine because he's made, I guess, as an educator, I'm an administrator at a school, and he's really opened my eyes to a lot of things and how many parents, have gone through a lot with their child because I've been very blessed with my own, I have a very positive story with my own child, and Jimmy in my life has really opened up my eyes and have really brought up I guess a lot of humility and knowing that there is more to what I can do with a lot of the children also that I deal with at the school. And like you said, Ms. Schroeder, a lot of the children who don't speak, can't speak up for themselves, especially the parents' family. So I'm more of a supporter for them. And Jimmy, every day I pray and I thank God because there's one point in when I tried to get him to walk because all he could do was slide. And so I said, okay, let me just try. I told everyone in my family, don't bother him. If he cries, let him cry. I want to see how strong he can be because I want to show him that he can do it. So I think he cried for about, 20 minutes? And everybody in my family thought I was the meanest person in the world, I was, let me just carry him. I said, no, you got to let him do it. Because once he gets that, he'll have that positive self-esteem, and he said, I can do it. And since then, he got up, he took his walker and he started to walk. And so he still has a long ways to go. Everyone loves him at the school, and I think, okay. And they'll say, Dr. G, let me carry him. I said, no, don't carry him. He can walk, And so they asked me, is there anything that he can't do at school? I said, no, he can do it. Just let him do it. And so I found out that some of my staff at the school, they're carrying his tray and stuff. So I got on them, and I said, I told you, let him do it. So now he carries his tray, but sometimes he's a very smart little boy. Sometimes he'll just look at you and then, everyone just melts and then they'll, and they wait till I turn and I said, so I had to sit everyone down and I said, okay, I know you love him. I love him too. But if I want him to succeed in life, he's going to have to learn how to do things for himself. And if they should ever take him away from us, at least I know that he can do it.
I want to thank you, Doc, for sharing that. And for the past, I believe, 3 years when I first met him, he's made an impact on me as well. That's why before coming down here, I told my staff, if Jimmy's there, make sure he sits right next to me again. So he's my honorary vice chairman, and really, I want to thank you for what you've done for him and all the other families for what you do for your kids. But these are the success stories that really show us how we need to sustain this program and really provide the support that you guys need. So thank you.
Thank you. Is there any other family that would like to? Sure.
I can feel exactly what you're feeling. We got Shantino. I was at the hospital when he was born, and his mother is an unwed mother, and no place to go, so we took her in and we adopted Tino. We were there, we were with her through the whole thing, and she's still with us. But she's not really a part of his life. I wanted her to be a part of his life because my husband Bill and I are both getting older. Bill will soon be 80 years old, and our baby's only 10 now. When I took him to Karinu, he would bang his head. He'd bang, bang, bang. He feels no pain. I could take and twist his, he doesn't feel it. He'd bang his head and be bleeding. We'd be at the hospital with him. What are you doing? Why aren't you watching this kid? I mean, I slept on the floor with Tino. I put him up against the china cabinet and the wall, and so I was on this side. He would have to touch me to get over me. And then if I fell asleep, I would wake up. Finally, we got him on medications, and then he would sleep forever. But he still feels no pain. And he has anger problems real bad. He's happy one minute, the next minute he's just last week he was choking his little uncle. We had an emergency trip to Dr. Ishmael because, and Caroline is his, whatever she is. I called Caroline, and she said, let's get him in now. So there again, without these organizations, my husband and I don't know what we would do. I really don't. My own children, they're all grown. My oldest son is 53, so that tells you the age difference between, and my own kids. None of my kids want us to have him. They all hate him. They really hate him. You don't need him, Mom. Well, I try to keep, yes. This baby's behind in school. He has a one-to-one aide. They can't let him go to the bathroom by himself because he'll disappear. He's gone. The other kids, if they laugh at him, if you laugh, even though we're laughing at you, right? You did something funny. He thinks they're laughing at him. And he just goes crazy. He's wild. He is strong. And he hurts people. And I'm the only one that he really can deal with that. I calm him down. I spend most of my life at school with him. And I don't mind. He's going to be a good boy. He loves dancing and singing, but our school doesn't provide any of that. I've even asked our principal, Mr. W, can't we get some little instruments? I don't care, guitars, I'll pay for them myself to give it in school. Oh, no, we can't do things like that. So I put him in karate. Well, wrong move, real wrong move. So he's in Special Olympics where he doesn't touch anybody in swimming. He doesn't touch anybody when they take him out in the yard to go jump. He can't tie his shoes. He can't pull on his own clothes properly. I help him get his pants on, his feet and up and all, or he's got 2 feet in everything. My husband. Now this is sad, but my husband does not even understand him. My husband says, but I've told him. I don't care how many times you tell him, he doesn't remember it. It doesn't stay. So these ladies and gentlemen here, without them for 10 years, I don't know what I would have done. I know you guys were crazy when I took him in, and it was 3 times a week I would be into the office up there. I mean, I spent my whole day trying to get people to help me understand what to do right. And, well, I'm learning, but please help them. They need it.
And thank you very much for sharing. Our family situations are very real. They don't go away after this session is over. They don't fold nice and neatly inside of a box that we can put the lid on. They're very real. We take them home with us, our families do, and it's the last thing they see before they go to bed, and it's the first thing they hear probably in the middle of the night as they wake up. It's just continuous. And so thank you very much. I really appreciate it. Any other family? Because I know yes, ma'am.
Hi, my name is Carinda Ferrey. I have a little girl. She's out there, and you may excuse my English if it's not really clear, but because of Project Karinu, I will try my best to say something about them. I have this little girl since she's 1 year old. She's still under CPS, and I try my best to take care of her. She's disabled. I have really struggled to take care of her because she's not mine, and I'm really struggled because my family don't accept her. And Until now, I still struggle. And I really love her. I got blessed from her. And when I got her, I thanks to Project Karinu. They're the first people I reached them to help me. They came out. They didn't just say it. They came out and see me and give me something to help her or support her. They support us a lot. They give us diaper, food, clothes, because we're really, even we homeless, because of the situation they don't accept her. And I thank God and thanks the Project Karinu for their helping us to have her. I still have her until now. I'm late to come here because I even reached out to education. I put her in preschool and I even asked for help. They helped me to make her, because she have a lot of problems. She didn't walk, she didn't hear, she didn't see, and she didn't talk. And she cannot even feed herself. She's 4 years old. But I try my best. Before, she didn't even move. She just like this. And she don't do anything. Now, she can crawl, and she tried to stand up, because I put her in school, and they help her to give her therapist, and that's her doctor, Dr. Meadow. And that's why I'm listening to what he's saying, and I'm asking you, Senator, please help Project Karinu. Please, we need your help. Not only them, even us. I'm sorry, because I am from Chuk, and I'm scared to say something, because I say, oh, they're not accepting us because we're Chukis. But it's still that I'm still reaching out. If you need help, reach out for somebody else to help you. That's what I do. I don't have anything. I am homeless. I'm homeless like 3 months with that girl. And I'm still having her with me. Some people help me, especially Project Karinu and CBS. Now my child is under CBS, and they're helping me a lot, and that's what I'm asking for you to please continue help Project Karinu to continue helping us more people. We need help. Thank you so much.
Ma'am, I want to just thank you very much for sharing that, and I want to let you know that it doesn't matter if you're Chukis or any nationality, you are part of us. You're our sister, and so feel free to anytime be able to reach out and speak up, because there's all of us here that of course will listen to you and do whatever we could to assist you. You're a people of Guam, so we're going to make sure that we listen to you as well. Thank you.
Thank you very much. And when I hear the words, we come here and we don't have, I think of, my goodness, for how many years the people of Guam, when they travel off island and they're away from families and extended families, they're kind of at the mercy of the community too. And so I would like to think that just as families that come here from our neighboring islands are blessed that we embrace and work with them, that our Chamorro families that go off island get the same warm reception as well. So it's that whole karma, what comes around goes around. And I would want the very best for our Chamorro families as well. So I would like to make sure that everybody gets an opportunity to speak. And if there is no other family or stakeholder or... Okay.
Okay. I had my son at 16 years old. I raised him alone until he was 2 years old. I didn't know what to do with him. So I sent him to school, daycare, because I wanted to go out and look for a job to support him. So at age 3, I put him into school. They told me they didn't know what to do with him. He's on timeout every day because he's hurting kids. He'll just go up to them, do random things, just to push them. He's biting, everything. I said, this is not my child. My motherly instinct had told me something's wrong. Something's wrong. This is not him. So I went and I had him tested through different schools. He was actually asked to be withdrawn from one school because they just didn't want to have to deal with his issues. That's how I felt. I was devastated. I said, I didn't know what to do. So I would cry at night not knowing, what am I going to do with him? I don't want to abandon him. I don't want to turn him away. So what I did was I went to special education. They helped me. They put me through all the testings, but they turned around and said that he did not qualify because he only had behavioral issues. His academics were really good. So I said, what else could I do? Is there any other agencies? They gave me a referral to Project Karinu. And when I went there, I said, I hope they're not going to turn me away because I really need the help I need. So when I went there, I walked in and I said, I need help with my child. This is what he's going through. He's currently not in school because a daycare center would not accept him. I was a young mother, so I didn't know where to go. I had no help, so sure enough, she's not here right now, but Jobeth Aquino, I know her personally as well. She goes, you've came to the right place. We will help you. And since then, they've gave me so many ideas and ways to cope with frustration with me dealing with my child. She's found different ways. She comes to me personally. I call her up in the middle of the night or at night. Oh, can you help me? My son this, my son that. Goes, okay, try to calm him down. This is what you can do. So every day, I speak to her on a daily basis, and she continues. And all of them, they continue. My son has worked with a great team of professionals, and I hope that they can continue to work with my son because every day we're learning new things through these kids out there. And they teach us, and we teach them. So I hope that they can get that opportunity to continue helping families and children out there that need the help. Most especially these young mothers, single parents that have no help. There's a lot of single mothers and single parents out there that does not know how to do it, so they just give their kids away because they don't know where to go. So hopefully, I hope they can continue to do what they're doing because they've done a really great job. I have nothing negative or anything to say. They've been really well. Thank you, guys.
Thank you for those kind words. I actually can't think of a better team of people if I had hand-selected them myself to make up the Karinu team. I can't begin to praise the staff enough. They really have the willingness, the patience, and the love in their hearts. It makes me wonder what their childhood was like when they were growing up, and what they were able to pull from that time and bring to the table today. They must have had wonderful, loving childhoods. So thank you very much for that. Again, I want to just make sure that everybody has the opportunity. I know we're up against time. Yes, ma'am. Sure, of course.
I wanted to add to Dr. Lily's pitch on the investment that the community will benefit from when there is the support to continue the mental health services. In our work at CSS, not only do we deal with the kids and the moms who have been victims, but we also work with individuals through the continuum. The individuals that have disabilities, those that are elderly, both in the positive and in the negative way. And we're seeing where services have not continued or has been provided to an individual. In some of our programs, we have individuals who are not able to really function independently because they've just been so down for the longest time that they don't know what they need to do as an individual. So Janelle's, pitch is that if a parent is struggling and does not know how to help their child, then how would that child also know what to do for themselves? And that's the part about life's teaching us, and back. We have kids who are in our group homes because they've attempted suicide and failed. But they're not able to continue being an independent individual, and the families do not want to be involved in their care. And that has also gone on to some of our older individuals where whether they're dementia or whether they're now manifesting behavioral issues that were repressed before, those are some of the situations that we're encountering now. And some of them, whether it's someone who was an independent individual and now in their last years, things are not happening, particularly if they're experiencing other than medical chronic conditions, dementia, and they're manifesting certain things through their demented behavior. And so there is a lot of truth, whether, I can't say there's research to it, but within that continuum, the investment that we have in really helping our kids to develop coping skills, to learn independent skills for self-care, to be able to give them opportunity and exposure for work, and how to be able to be independent. I think that's all of what parents are trying to have. And now we're working with parents who have been caregivers, and they're in their 80s, and they're wanting to plan who is going to take care of my child when I die or when my husband dies and I cannot be the one to take care of them. And our children are not here on Guam. They may not want to be able to assume that responsibility. And so when you're looking at the full spectrum, if we don't invest in these prevention measures, then we're spending a lot of money in the judicial area, law enforcement, for those kinds of situations where kids are doing things to hide the anger, the fear, whatever it is that they've experienced that has not been resolved. And then when you think about the cause for incarceration, and then when they're discharged and the reentry and how they're not able to cope within the community because they've been behind bars for a long time, or individuals who have just been in such a bad environment that they're choosing to leave, and those are some of our homeless, including our homeless elderly. And when we outreach these individuals and we hear their stories, I've been a social worker close to 30 years, and just when I think, having worked in the welfare office, that I've seen it all and heard it all, it's not. Because there's new situations coming in that makes the whole family dynamic so complex. And if we can't handle the stress of being poor, of managing our money, of doing kids and doing, working and raising family, how will we be able to model that to our kids so that they will be able to develop their own kind of coping mechanisms? And so it's really we're just talking about, a couple of programs now that the federal funding part of it may be ending. But really, when you look at it, where does this particular function fall within the whole range of developing the total person? And if we're going to invest in Guam, it's all of it, public safety, health. We just need to come together to develop that plan, not looking at it necessarily in a compartmentalized, just looking at Project Karinu. I think Terry did a really good job at seeing how well it's integrated within a public health concept. And so we kind of need to look at it. That's the whole beauty of systems of care, it's not necessarily one particular design. It's really what is it that works well for our island community. Thank you.
Thank you, Diane. Thank you for those words as well. And we are strongly putting together for our island the one system of care. And of course, that's the partnership between Project Karinu and Ifa And it really is bringing together the Department of Public Health and Guam Behavioral Health and Wellness Center. And you're talking about two agencies that serve one population or island, but do so in a manner that's actually quite different. And as Lily had mentioned on the early childhood side, it really is about casting a much finer and a much broader net of children, and then that way we can really identify a higher population, especially those around imminent risk. Ifa many of their referrals have already been identified, and of course they're focusing on the serious emotional disorders of children. So it's embedded in public health, and thank you for highlighting that for a particular reason. Again, I want to make sure that everybody has an opportunity, and I know, again, we're up against time. I would like to make sure that we also acknowledge, we call it Karinu's birthday, but in the bigger picture, it really is about acknowledging the service delivery component of the program and really celebrating that with our families. So I'd like to also make sure that we extend the invitation to all of the people that are in this room to help themselves to pizza, to fruit, to drink, and to come together and break bread today. So, Senator?
Great. Thank you very much, Terry. Again, before we end, I want to give the opportunity to any of my colleagues to, if they have any comments or questions. Senator Uggan?
Thank you very much. Thank you very much, Mr. Chairman. And first of all, thank you for following up on this particular project and continuing to advocate for it as the chairman of Committee on Health. I really appreciate the total community approach to today's presentation, because it wasn't just Project Karinu. It was the stakeholders, inclusive of the parents, the children, the family members, and many of the partners out there that contribute to this entire system of care. So I really have a very special appreciation for how this entire format was presented. The one question that I have, in this case, Terry or Dr. Lilly, is I noticed that in your third to the last slide, it said, please don't let it go. Can you explain that, please? In terms of whether, in fact, the federal funding source is expiring? What are you looking at in terms of the overall federal funds?
Sure. And
how we can transition through the assistance and the guidance of the chairman in terms of being able to work with appropriations and fund that.
Absolutely. We did include Karinu's budget in last year and this year's public health budget. But we did hit a few snags, although it was approved by the legislature when it actually moved up the channel or down the channel or around the channel. It hit a few snags. But we can talk about those snags later. But it really is about the fact that Project Karinu, again, was funded under SAMHSA. And like many federal grants, they come and they go away. And here the seeds were planted to really make a huge impact for our island's children, regardless of socioeconomics. And so the funding is indeed, technically it would have went away in 2015, but we were at a no-cost extension. And so this year we were able to receive a small pocket of money of $100,000 in combination with local funds to keep the program going. Next year will be 100% locally funded, is what we're striving for. And I did bring a copy of that budget, which I will share with you.
Good afternoon. I just want to say I've been at this legislative hall or session, public hearing room for over 3 years now, or 3.5 years, and I tell you, this has been a very interesting place, controversial area, but I've never felt so much support and love by an organization for our community, especially with our children and our families. This is the first time I've been part of a presentation by Project Karinu, the team and the partners that I heard of, and I thank you for educating me today and bringing a lot more awareness to on how we can proceed forward in supporting this organization. I've been looking at all these shirts, and I thank all the families and the organizations for putting them together. I've been reading through them, and I'm really amazed by this program, and whatever I could do as my capacity, working with the chairman, working with the community to help grow this organization. Like you said, you have 800 families that you have served, but certainly we know we can expand that further. There's a lot more need out in our community. I have to say, when I first walked in there and I saw a lot of children, I wanted to go home right away to my 18-month-old son, and that's what it does to me. But I thank you for the testimonies by the families, and I'm deeply moved. Thank you. Thank you.
I just want to say to Zeus Maasi for taking the time and the care to put all the detail in, because that actually adds to the ambiance and the significance of your outreach. It's very difficult to not sit here and listen and hear your voices. It's very difficult not to care about what you're doing. And I just want to thank you very much for everything that you do, and plead with you to please don't lose steam, because it is just, it's overwhelming for me to sit here as a mother who raised 3 kids, and now I have 8 grandkids with issues of their own. Each one of them is a different character. So you can appreciate all the little nuances that it takes to successfully raise and help a child to be successful. But to all of you, God bless you for everything that you do. And it is hard not to love each one of you and to want to do everything that we can to make sure that you succeed also in what you do. So, si Zeus Maasi.
Thank you very much, Senators, for being here, and also for our other colleagues who are tuning in. And we'll make sure that they get a copy of this session that we had here. But Terry, I want to just say thank you very much to you and your staff. These are God-sent angels. At the work that you guys do over the years, and we've been working very closely. I want you to know that you have, at least this committee, all these senators here, full support of the program. I know that it's part of the budget submission again, and when we have that budget hearing with the department later on, I believe in the summer, then we can get into the details of what needs to be done to ensure that what we say here today about our support is there and continues this program. I know that we've also been talking with Ms. Annie Pinko over at Behavioral Health. Just like them, when they were, I think they started off just like Karinu as a federal grant, but it's been maybe 10, 15 years now after that they're still around, but it's not cemented in stone, and I think that's what we want to do here, is ensure that this program is sustained even after our time, because we know of the need, we know of the successes that this program has done for many 800 families now. And as Dr. Meadows has said, that there's room for more. There's room for more of our children that need this type of service, and so we'll ensure that we bring it up. I have 3 other senators here that, when it comes down to the floor, are going to advocate and make sure that we get this message across. But I think if over the years you've seen the support and the snags. I understand the snags that you hit. A lot of these are administrative snags that we have to address, and so we'll be happy to work with you in moving forward. Okay?
Thank you very much, Senator, and thank you for your time. I understand there's several things that are scheduled for today, so we really appreciate your time as well as the families that made it out here today and were able to share their stories. I can't thank you enough. And again, I'd like to extend the invite for pizza, not too healthy, but we do have fruit. So I know Al's with non-communicable diseases, but still lots of healthy things that you can find out there. So thank you, and Senators, thank you again. We really appreciate it. Okay. Yes.